If you're over 60 and still touching yourself the same way you did in your 30s, you might be doing more harm than good. I'm Dr. Lana Williams, a board-certified urologist with over 20 years of experience, and I've seen what happens when men don't adapt their habits as they age. Poor circulation, prostate inflammation, even nerve damage, these are real risks when you ignore the changes happening inside your body. Most men don't know this. Masturbation after 60 isn't unhealthy. In fact, it can actually protect your prostate and keep blood flowing. But only if you do it the right way. And that's the problem. Today, I'm going to show you the 3 biggest mistakes older men make when masturbating, the warning signs that mean you need medical help right away, and a step-by-step guide to doing it safely so you can keep your health, your confidence, and your performance strong. So stay with me, because what you'll learn in the next few minutes could save your sex life, and maybe even your prostate. Finally, let's talk about the warning signs that mean you need to see a doctor right away, plus how to bring it up without feeling embarrassed. Trust me, I've been in urology for over 20 years, and I can tell you, these conversations are never as awkward as men imagine. What is awkward is ignoring the problem until it's too late to fix. Now, the first and most damaging mistake I see men over 60 make is using too much pressure or grip strength. As sensitivity fades with age, a lot of men instinctively squeeze harder or press more firmly. But that's the exact opposite of what you should do. The penis contains delicate erectile tissue, the corpus cavernosum, spongy chambers that fill with blood, along with tiny blood vessels and sensitive nerves. If you keep compressing them, you're basically bruising the system over and over. Over years, this leads to nerve damage, poor circulation, and even permanent numbness. I've had patients who could only finish with such a tight grip that it would actually be painful with a partner. That's a classic sign of long-term damage. The solution? What I call pressure titration. Start with the lightest touch you can feel. If it takes a minute or two before nerves respond, that's normal, your body is simply slower now. Let sensation build naturally, and never grip so hard that you flatten the shaft. Think of it as a gentle massage, not a mechanical squeeze. If this advice is hitting home, make sure to subscribe to Vital Health Seniors, because my next video reveals the 3 biggest erection killers that have nothing to do with testosterone. You don't want to miss that. Now, let's move to the second mistake, going at it too often. In your 20s and 30s, daily, or even multiple times a day might not have been a problem. But after 60, things change. Your prostate, which produces about 30% of semen, needs more recovery time. If you push it too often, you risk inflammation, discomfort, and even prostate enlargement. Your hormones also shift with age. Frequent ejaculation can throw off your testosterone rhythm, leaving you tired, moody, and less interested in sex. I've even treated men with what I call ejaculatory fatigue syndrome. Orgasms become weaker, take longer, and leave them drained instead of satisfied. The sweet spot for most men over 60? Every 48 to 72 hours, sometimes less. Many of my patients find that spacing it out to 2 or 3 times per week actually makes the experience stronger, more enjoyable, and more energizing. At this stage of life, it's all about quality over quantity. And the third mistake, not using lubrication. A lot of men assume lube is just for partnered sex. That's flat out wrong, especially after 60. With lower testosterone, your body produces less natural lubrication, and the skin on your penis becomes thinner. Dry friction leads to micro tears you can't even see, but they're big enough for bacteria to sneak in. The result? Pain, infections, chronic inflammation, even scarring that permanently reduces sensitivity. The fix is simple: always use a good, unscented water-based lubricant. Avoid oils if you ever use condoms, and steer clear of artificial fragrances or harsh chemicals that irritate sensitive skin. A small investment in the right lube can save you from major medical issues later. Now, let me give you my full protocol, what I call the care method. C. Cleanliness and comfort. Wash your hands, choose a private, relaxed space, and avoid hard chairs that press on nerves. Reclining or lying on your side works best. A. Appropriate technique. Use lube first. Start gently. Switch hands or positions to avoid strain. Think slow build, not fast finish. Respect recovery. Allow 48 to 72 hours between sessions. Give your prostate, hormones, and nerves time to reset. Evaluate. Listen to your body. Any pain, changes in sensation, swelling, discharge, or urinary problems, see a urologist. Don't wait. Speaking of that, here are the red flags you should never ignore. Pain lasting more than 30 minutes after masturbating. Sudden numbness, burning, or tingling that doesn't fade. Swelling, bumps, unusual discharge, or bleeding. Urination problems linked to sexual activity. A sudden, lasting drop in erection quality. If you notice any of these, please don't suffer in silence. Urologists like me have seen it all, and catching issues early can save your health and your sex life. Here's the bottom line: masturbation after 60 can be one of the best things you do for your circulation, prostate, and stress levels. But you have to adapt: gentler, slower, less often, always lubricated. Your body deserves that level of care. If you found this guidance valuable, subscribe to Senior Medical Center for more trusted advice. And remember, your sexual health is part of your overall health. Don't ignore it, don't be ashamed of it, and don't wait to get help if something feels wrong. You've earned the right to age with confidence, comfort, and dignity. Take care of yourself, you deserve it.